Now we're going to discuss diagnostic tests and procedures. It is important to keep in mind what teaching we need to provide to patient and family. Teach them what to expect. Patient preparation, support, and follow-up. Do they need any preps before the tests? Well, what about nursing assessment? Is it supporting the diagnosis? Assess medications that may affect the outcome of the test. And what else is important? Well, monitoring the response to treatment and post-procedure care. Patient advocacy, meaning, is the test appropriate? Skull and spinal X-ray studies are non-invasive, painless. There's no prep necessary. For skull, it'll help with size, shape, suture separations, fractures, bony defects, or calcification evaluations. If spinal, it'll help to detect fractures, dislocations, compression, stenosis, cancers, and degenerations. A computed tomography, or CT scan, is also non-invasive and painless. Prep is going to depend on the study. The patient must lie still, and if there is suspicions for intracranial bleeds, it should not include contrast. PET CTs can help evaluate skull fractures, intracerebral or subarachnoid hemorrhages, tumors, cysts, aneurysms, edema, ischemia, atrophy, and tissue necrosis. It could help evaluate if there is any blood fluid or pus. A spine CT can assess bony abnormalities. Well, it's important to ensure consent, as usually there can be intravenous contrast. Now, iodine-based contrast means that we need to assess for allergies, such as allergies to seafood or iodine. A hypertonic solution is used, which means that it's going to be very concentrated, and we're going to need a large catheter in the vein. It can damage tissues otherwise. The dye is injected rapidly, meaning that the patient can experience flushing or throat irritation. What are some symptoms with dye injection? Again, flushing, metabolic taste in the mouth, and the sensation or urge that they have to urinate. So it is important that the tech explains that to the patient. Intravenous contrast is contraindicated in patients with renal failure. It is very hard on the kidney. Also keep in mind important nursing considerations, such as the need to hold metformin, named glucophage, prior to the test and for 48 hours post-procedure. In patients with renal disease, mucomist may protect the patient. Magnetic resonance imaging. It uses radio frequency and powerful magnetic fields to obtain images. It's helpful in diagnosing strokes, tumors, trauma, seizures, and multiple sclerosis. Gadolinium is a construct that may enhance visualization. Well, what are nursing considerations? The patient is going to be in a confined space, but should be able to communicate with the technician. It will be noisy, but the patient will be given earplugs. There is a weight and size limit, so evaluate for those concerns. Also, it is a very long procedure. Remove all metal objects and credit cards. They can cause burns. And inquire about metal clips inside the patient. Those are all important assessment and teaching. If the patient is using any transdermal medications, it's going to be very important to take those off and replace after the procedure. Those can also have a metal strip that can cause burns. Teach the patient to communicate those concerns prior to any further MRIs in the future. Sedation may be used as ordered. And well, what about the IV pumps? You can leave them in the patient's room if it is not needed and if the patient can have a gravity flow. PET scan, or positron emission tomography, evaluates brain function, blood flow, and volume. A radionuclide by gas or injection helps differentiate dementia types and identifies tumor stages. The PET scan looks at glucose metabolism in the cells, and oxygen uptake and blood flow. The single photon emission computed tomography, or SPECT, is similar to PET. It helps diagnose strokes, brain tumors, and seizure disorders. Both PET and SPECT are expensive. The test takes about 30 to 45 minutes. There usually is a prep 24 hours prior, including no coffee, alcohol, or smoking. Also, the patient should be NPO for 4 hours, and we need to assess the level of glucose in the patient. Post-procedure is very important to encourage fluids. EEG, or electroencephalography, looks at abnormal impulses. It records electrical activity generated in the brain's cortex. When will it be abnormal? In what conditions? Well, with seizure, metabolic disturbances, toxic conditions, coma, dementia, narcolepsy, insomnia, tumors, brain abscesses, blood clots, or infection. It is used to determine brain death. Well, what are some nursing considerations for EEG? Patient teaching points is going to include that the duration of the test is about 45 to 60 minutes. We need to reassure them about what? That it is not painful and it is not an electric shock. Unfortunately, many patients believe that that's what it involves. And what is its preparations? The patient needs to wash their hair the night prior and not to use conditioner. Also, they need to limit their sleep as per orders, so sleep deprivation is part of the prep. Is there any medications or foods to hold? Yes, caffeine or alcohol. We don't want the brain to be stimulated or slowed. For best results, also hold anti-seizure medications if the patient is in the hospital. Otherwise, to take medications unless otherwise instructed. Cerebral angiography is a vascular study to help diagnose aneurysms and arteriovenous malformations. There needs to be a femoral or brachial catheter site for contrast material to be injected into the carotid or vertebral arteries. Pre-nursing considerations include hydration status. Assure that the patient is well hydrated. Ensure consent that is signed and the patient is NPO for 6 to 8 hours prior. IB access, allergies to iodine or selfish. Med considerations, no Coumadin 4 days prior. And wet labs, PT-INR, PTT, BUN, and creatinine. Remember, renal function needs to be evaluated for contrast. Post-procedure, monitoring is important. Vital signs, color, temperature of the involved extremity for possible embolism. Signs and symptoms of altered cerebral blood flow. Force fluids. Activity. Patient should be on bed rest for 12 to 24 hours. And complications include hematomas, so a pressure and ice bag needs to be at the catheter site. Evaluate PRN. Delayed allergic reactions can occur to contrast dye, so evaluate for that. Non-invasive carotid flow studies. A Doppler ultrasonography and Doppler scanning measures arterial blood flow to evaluate carotid artery, arterial blood flow, and detect arterial stenosis, occlusion, or plaque. It is non-invasive and there's no prep necessary. Cerebral spinal fluid. It's obtained via lumbar puncture using strict asepsis. What are the risks and contraindications? Patients with increased intracranial pressure. Remember that. Pre-procedure. Informed consent needs to be obtained. Explain to the patient what to expect. They need to empty the bladder, and there may or may not be sedation used. During the procedure or intra-procedure care includes positioning. We will see that in the next slide. Proper ordering, labeling, and transportation of the tubes. And post-procedure, monitor the site, vital signs, and changes in neurological status. And what position is used to prevent post-lumbar puncture headache? Lying flat for 4 to 8 hours may or may not be indicated. This picture shows that a spinal needle is inserted into the lumbar 3 or lumbar 4 or L4, L5. The patient needs to lie on the side with the back close to the edge of the bed, the chin and knees to the chest, or sitting, leaning over the bedside table, chin to the chest. Other diagnostic studies may include laboratory tests based on medical history. Peripheral nerve studies include electromyography, which is useful in diagnosing neuromuscular diseases. This test requires no caffeine or smoking 3 hours prior. And patient may need to hold muscle relaxants, anticholinergics, and cholinergics. The other test is a nerve conduction velocity study, NCV. It is useful in identifying peripheral nerve disorders. Myelogram. It examines the spinal canal under CT guidance with contrast into the subarachnoid space. Muscle or nerve biopsies help evaluate myopathies and neuropathies.